What has your manager asked you to do that you outright refuse to do? I worked night shifts at a busy metropolitan hospital where life and death decisions happened every minute. Our protocols were sacred, especially medication administration, which required double-checking every dosage, every patient, every time. No shortcuts, ever. It was 2 a.m. on a chaotic Friday when a perfectly dressed woman in designer clothes burst through our ICU doors, her heels clicking urgently against the sterile floor. Despite the late hour, her makeup was flawless, and her blonde hair looked freshly styled, as if she'd just stepped out of a salon. "I need to see my husband immediately," she demanded, her voice carrying the authority of someone accustomed to getting her way. "Room 304. He's been asking for his pain medication, and I brought his prescription from home." She placed an expensive leather purse on my desk, pulling out a pill bottle with trembling manicured fingers. The label looked official, but something felt off. Her eyes were dry despite claims of worry, and she kept glancing at the security cameras with calculated precision. "Ma'am, we can't administer outside medications," I explained gently. "Hospital policy requires all drugs to come from our pharmacy for patient safety." While I spoke, a distinguished man in a white coat approached us. His badge identified him as Dr. Marcus Webb, though I'd never seen him before despite working here for 3 years. "I'm the attending physician," he announced smoothly. "This is a special case. The patient has severe allergies to our standard medications." His wife brought the only safe alternative. He was incredibly authoritative, speaking in medical terminology that sounded impressive but felt rehearsed. The woman nodded eagerly, dabbing fake tears with a tissue while maintaining perfect eye contact. When my supervisor Janet arrived, Dr. Webb immediately took control. He flashed medical charts with official letterheads and spoke about liability issues if we denied treatment to an allergic patient. "I can personally vouch for this medication," he declared confidently. "I've prescribed this exact dosage myself. Mrs. Richardson just wants to help her suffering husband." He was smooth and incredibly convincing. Janet started nodding, already reaching for her override codes to bypass our safety protocols, but every instinct I possessed screamed danger. "I refuse to administer this medication," I said firmly. "Something about this situation feels completely wrong." The woman's composed mask slipped for just a moment, revealing cold calculation beneath her performance. Her hand gripped the pill bottle so tightly her knuckles turned white. Janet's face flushed red. "Give the patient his medication immediately, or I'll find someone who will," she snapped. "This is a direct order from your supervisor." "Absolutely not," I replied, stepping between them and the medication cart. "I insist we verify this doctor's credentials and test this medication first." The fake doctor became visibly agitated, his professional facade cracking. "There's no time for this bureaucratic nonsense," he hissed. "Do you want this man to suffer because of your rule following?" Janet threatened to fire me on the spot, her voice echoing through the ICU loud enough that other nurses stared, but I held my ground. "I will not be party to what looks like attempted murder," I declared. "Not on my watch." The man grabbed the woman's arm roughly and they fled toward the exit, practically running past security. Janet spent the next hour screaming about patient care and following orders. 3 hours later, police detectives arrived asking about a suspected poisoning attempt. The patient was actually the woman's wealthy ex-husband, and she'd been trying to kill him for insurance money. The pills contained enough cyanide to kill 10 people, and the fake doctor was her accomplice. They had successfully murdered 2 other patients at different hospitals before trying ours. Janet was terminated immediately, and I received a commendation from the hospital board for preventing a murder.